Would you please indicate the main reasons why the World Allergy Organization Special Committee on Drug Allergy decided to commission a paper on hypersensitivity reactions to non-beta-lactam antimicrobial agents?
Well, first of all, most papers on antibiotic allergy are related to beta-lactams. It means penicillin and cephalosporins. And these non-beta-lactam antimicrobials are a wide group of drugs, and the information on their side effects are scarce and is diffuse in the literature. So it was thought by the committee that putting together all this information could be a useful tool for physicians worldwide dealing with these kind of drugs which are widely used.
According to your experience, what is the prevalence of allergic reactions to non-beta-lactam antibiotics as a group, and which of them are the most prone to induce allergic reactions?
Well, this is a very large group of products, and as you can see in the document, there are many different drugs that belong to this group. So this is very variable according to the drug. For example, macrolides have a very low incidence of induction of hypersensitivity, and for example, tetracyclines are not very frequently used today, so we are not seeing more reaction than we saw years ago. For example, sulfonamides are a frequent cause of allergy and hypersensitivity, especially in certain groups, population of, as a sample, HIV-infected people. And with the increased use of quinolones in the modern age, we are seeing more and more reactions to this group of drugs.
I see. All right. I would like to ask you about desensitization. If it is carried according to the recommended protocols, how safe is it? And what is the generally recommended rate of lethal events related to desensitization?
Well, first of all, desensitization has to be done by trained physicians, and we prefer that allergists who have the best training for desensitization are the people doing that. This should be done in the proper place with having the resources to treat reactions that can occur during the process. We are not aware of any death related to desensitization to these drugs, but we had to recognize that many of the protocols had not been validated yet for some of the drugs.
In the context of the global agenda for drug allergy research, what are the next goals for this group?
Well, there are many unmet needs in the area of drug allergy because sources of funding for research are limited, and we depend only on the interest of the investigator who put all the effort and dedication and commitment to do this kind of research. But there are lots of things to be done. For example, we had to increase study on epidemiology and risk factors, trying to identify the patients who are prone to this kind of reactions to these drugs. We need a better understanding of the pathogenesis. We need improved methods for diagnosis. For example, we need more in vitro method. We have good specificity and sensitivity to avoid patient the risk of reactions related to in vivo provocation tests. And finally, we need also to validate the desensitization protocols, and we have to obtain a better characterization of cross reactions between different drugs of the same group, because this is important to make a prevention of the reactions.
Thank you.
Thank you.